Good afternoon, doctors. Welcome again. Today we are going to discuss about mumps. Mumps is an acute systemic infectious disease caused by RNA paramyxovirus, spread by respiratory droplets, and before the advent of the mumps vaccine, it affected school age children commonly. So incubation period is 16 to 18 days, and I have live case of mumps who is suffering from orchitis bilateral parotitis. Let's see. Mumps clinical case definition: acute onset of unilateral or bilateral tender self-limited swelling of the parotid or other salivary glands lasting more than 2 days without other apparent cause. See, this is a case of mumps, but I have a case of mumps adult. Key diagnosis: parotitis at least 2 days, persist more than 10 days. History of missed or no vaccination or possible vaccination failure, primary or secondary. Others include constitutional symptoms. Orchitis: in my patient, he is suffering from orchitis, ophthalitis, aseptic meningitis, mastitis, encephalitis, and deafness. Okay, let's see the sign of mumps. Its swelling of parotid gland is visible here, ear pain when chewing, difficulty in swallowing. That patient complains all. Now, mumps symptoms: fever up to 103 degrees. My patient has fever in Fahrenheit. Headache, yes, he is also suffering from headache. Muscle aches, yes, he is suffering from muscle ache, weakness and fatigue, malaise. Loss of appetite, pain when chewing or swallowing, swollen glands in the neck. Okay, risk factors of mumps is unvaccinated status, immunosuppression, healthcare worker by droplet infection through a patient. A healthcare worker can affect international traveler, close contact living, college student, prisoners, military, vaccine failure. Okay, let's see. Paramyxovirus, not being vaccinated, close quarters with unvaccinated people, immunosuppression. These are the risk factors. Now, first investigation is salivary mumps IgM level. Lumbar puncture we can go do CBC, serum mumps IgM, serum mumps IgG, reverse transcriptase PCR, serum amylase, viral culture, CSF saliva or urine CT head. Okay. Treatment: there is no specific treatment, but we have to treat symptomatically like acetaminophen or bed rest, MMR vaccine. First dose 12 to 15 months, second dose is 4 to 6 year. Isolate infected 5 days onset of symptoms. Now, there is no specific antiviral therapy. Treatment is entirely supportive. Antipyretics like acetaminophen or ibuprofen are indicated for fever. Bed rest should be guided for a patient needs, but no evidence indicate that the prevents complication. The diet should be adjusted to the patient ability to chew. So guys, I hope it's clear for you till here. Have a good day. Goodbye. That's all for today. If you like this video, put like on it. And if you have any queries, question, you can ask me. And if you still not subscribe my channel, please subscribe it. Thank you. Good day and good.